And on Memorial Day weekend, 2002, it'll be 7 years this coming May, I got another telephone call, and this one was from the University of Virginia to tell me that they had lungs for me and to ask me, are you ready for your transplant? And I said, can I think about it for a minute? And they said, sure. I thought about it, and I said, I don't think I've smiled for 6 months. Yeah, I'm ready, let's do it. And the air ambulance picked me up at the airport, flew me 500 miles from Atlanta to the University of Virginia in Charlottesville, Virginia. And the next thing I knew, I was in the operating room, shaved down, painted yellow with betadine, and listening to music. It was really kind of very comfortable. And again, I was very relaxed. And it wasn't long before the nurse came in and said, the surgeon has seen the lungs. They're ready. And I'm lying there flat on my back, and the anesthesiologist leans over and he says, are you ready for this? And I said, let's do it. And everything went black. When I woke up, I was very happy because waking up alive was my #1 priority. But I wasn't just alive. I was alive and I was breathing. Granted, I was breathing on a machine because that's what happens after you wake up from a lung transplant. They don't let you breathe on your own. You're intubated with a ventilator, and that was okay because I was breathing. The miracle to me, this is actually 2 days. I was still on oxygen. I wasn't on the ventilator anymore. You will see they got things sticking in me all over the place. And I'm still in ICU, and actually had right here, there are here and here 4 chest tubes coming out, draining fluid from the inside of my chest. And within a couple of days, I was off the oxygen. Within about 5 days, I was not just off the oxygen, I was back on a treadmill. And where before the transplant, I was lucky to be going about 1.5 miles an hour on oxygen, 6 liters. I found myself 5 days after my transplant on a treadmill, not breathing oxygen, going 4 miles an hour with a pulse oximeter on my finger that was telling me that I had 100% oxygen saturation, breathing room air. And I was stunned. And it just got better and better and better and better. And they let me out of the hospital after 2 weeks, and I went home and I took up mountain biking. I couldn't run because I had artificial hips, but I couldn't walk fast enough anymore to get short of breath. Now, can you imagine that? That could not make myself short of breath. So I had to find something that would do it for me, and mountain biking was a wonderful cure. And that summer, it was 3 months long, and all I did was, I cycled everywhere. I don't think I drove anywhere that summer. And I was mountain biking all over the place, and I built my body back up, and I finally, it was heading into this opportunity to actually do the exercise that I'd wanted to do for so many years. For 8 years, I'd been trying to do this kind of stuff and couldn't, and now I could. And I loved it. Until the wreck. I went over my handlebars doing a Superman. I'd been pushing myself to my limits, and I apparently went a little bit beyond my limits. You don't become a professional mountain biker in 3 months, but I was pretending. And it was very, very painful. I landed on my left side. The very first thought that went through my mind when I landed was, what the hell am I doing on a mountain bike with artificial hips? That just doesn't make any sense. And it was like it had never crossed my mind until that moment. And the pain was so bad I thought I had dislocated my hip. And it wasn't until much later that I found out that I had not dislocated my hip. I had shattered my femur. There was one little bit of comic relief, though. It was when the EMTs came in and put a little hardboard down next to me to carry me out of the woods. And they said, Mr. Geiger, before we touch you, we're going to take a brief medical history. point where they were reading me the riot act for mountain biking with artificial hips, and I'm going, but wait, there's more. And you could literally hear the sound when their jaws hit the ground, and I explained, I'm 3 months out from a double lung transplant too. And you know, they put me on the ambulance, and I could hear half of the conversation. They're talking to the ER guy, and he's going, no, I'm not kidding. No, really, no, seriously. And it was you know, a relatively nice end to a horrible situation, or so we thought. It took 5.5 hours of surgery to put my leg back together, and this is another one of those examples of the miracle of modern science. You can't really see what's going on. There's the miracle shooting right there. They think it was a fat embolism from my long femur that during the operation busted loose and hit my lungs. And I went into complete respiratory failure. And a nurse found me in the room, slumped over, not breathing, unconscious. And they put me back on life support, intubated me again, put me into a drug-induced coma. And they airlifted me back from Georgia to the University of Virginia, where, as my transplant pulmonologist says, we saved his life again. It wasn't really quite so easy, though, because it was 3 weeks before I was breathing on my own. And part of the course, I was in the medical ICU when all the sirens went off. I don't remember any of this. I was in a coma, like I said, and they came running into the room, and I had extubated myself. I'd taken the thing completely out and was lying on the bed breathing on my own, where they had not been able to get me to breathe on my own. And they put a mask on me with O2 and sent me home 4 days later, after a warning from an orthopedic surgeon who said, not really sure if you're going to be able to use that leg again. And if you can, you're not going to be able to use it normally. Well, he should have known better than to challenge me. Because as soon as I could get up on a walker, I said, that's it, I got to do pulmonary rehab, I mean not pulmonary, but physical rehab, and get this leg back in shape and get my body back in shape. I had lost almost 40 pounds while I was in ICU for 3 weeks. I lost every bit of muscle tone I had, and it took a really, really long time to get back in shape. It was 3 months before I could even touch my left foot to the ground, because that bone was still trying to heal. And I developed another attitude about exercise. It was actually more difficult because I was in much more dire straits than I had been in even before my transplant. And I decided to modify my old saying. It was still reevaluate, rehabilitate, but now it's never, ever stop. And so I pushed and I pushed and I pushed, and 10 months later, after this bike wreck, I was in better shape than I had been in my entire life. 10 months after this horrible, almost life-ending bike wreck, and you know, all these horrible things happening, and all this exercise that I had done, I did the Peachtree Road Race in Atlanta, the world's largest 10K. And 2 weeks later, I did my first triathlon. That summer, the next summer after the mountain biking summer, I did 5 triathlons. And you know, these are just some of those, and the different races that I'd done all over the Southeast, some in Florida, some in lakes, some in oceans.